We're going to run through full mouth rads in a dog. The techniques I'm going to show are the ones that work well for CR plates or those ones for traditional film. The first one we're going to start with are the incisors. With incisors, it's important as far as the cone to get the cone low enough that it's centered right in the middle of all 6 of the incisors. So my goal here is to image all 6 of those incisors at the same time. So you want to get the cone low enough so that you see it coming nicely central through in the middle of all 6 of those incisors. If there's any tilt on the cone at all, it's going to make the incisors look like they're overlapping each other to some degree. As far as film choice, I generally pick a size of film where both canine teeth can bite on it. If I look at the size 2 film that I have here for CR, it's going to be close, but probably not my first choice because it's going in between the 2 canine teeth. What will likely happen is I might cut off the outside edge of those maxillary incisors. So if you have digital and you have a size 4 plate, then that's my #1 choice in order to image all 6 of those incisors without having to take an unnecessary retake. To keep your film in position, just take a little bit of paper towel on the opposite side of the film, like that, and then you're ready to go. Incisors are teeth at the front of the mouth, so the bird's eye view as far as figuring out how they seat themselves in the skull is at the side of the patient. If you follow the crown of the incisors, you're going to be quite off with your tooth angle. So you got to force yourself to remember that when you're dealing with a dog, incisors on the maxilla and the mandible as well as the canine teeth curve quite distally in the skull, and that's really what you want to focus on when you're trying to figure out your tooth angle. So do your best to ignore the crown of the tooth and focus on the root. So this is showing me the approximate way that those incisors seat themselves in the skull. Standing at the patient's side, I'm going to use the side edge of the plate, so halfway in between those 2 brings me to here, and that's my bisecting angle. So with my cone low enough centered in the middle of all 6 of those incisors, what I'm going to do now is just make sure that my cone is directed right onto that bisecting angle so that if I could get this stick moving in the air, it would be flush with the end of the cone. And that's how I would image my maxillary incisors.